The first 72 hours after a knee injury matter far more than most people realize, and most people get them wrong in one of two ways. Either they try to push through the pain and carry on, or they rest completely and do nothing, waiting for it to settle on its own. Both approaches slow your recovery. Let me walk you through what to actually do in those first 3 days, step by step, so you give your knee the best possible chance of healing well. The first thing to get right is distinguishing between a minor soft tissue injury that can be managed at home and something more serious that needs to be seen that day. Go to an emergency department rather than waiting if you cannot put any weight through the leg at all. If the knee looks obviously deformed, if there is severe swelling coming on within the first hour, or if the knee buckles completely and will not hold you. These are the patterns of serious structural damage, and they need imaging and specialist review promptly. For everything else, the common strains, sprains, and partial tears that make up the majority of knee injuries, here is how to manage those first 3 days well. The first principle is protection with partial movement, not complete rest. The old advice to rest and immobilize an injury completely has been replaced by current evidence showing that gentle, pain-guided movement is almost always better. You want to avoid the movements that are clearly aggravating the injury. The deep bends, the twisting, the activities that reproduce sharp pain, but you want to keep moving through the range that feels tolerable because movement maintains blood flow to the area, prevents excessive stiffness from setting in, and keeps the muscles around the joint active. If you can walk with a normal gait pattern, walk. If walking makes the knee feel significantly worse, use a crutch or take shorter strides rather than stopping altogether. The second principle is ice for the first 24 to 48 hours if there is clear swelling or heat in the joint. Ice reduces the local blood flow, which helps limit excessive swelling in the acute phase. Apply it for 15 to 20 minutes at a time, with a thin cloth between the ice and the skin to prevent a cold burn, and leave at least 2 hours between applications. After 48 hours, once the acute inflammatory phase is settling, heat is usually more helpful. It increases blood flow to the area, relaxes the muscle guarding, and makes movement more comfortable. The third principle is compression. A simple compression bandage or compression sleeve around the knee reduces swelling by preventing fluid from pooling in the joint tissues. Wear it during activity and rest, but make sure it is firm without being tight enough to cut off circulation. Your toes should not tingle or turn blue. The fourth principle is elevation when you are resting. Lying with your leg elevated above the level of your heart helps drain the fluid out of the joint tissue passively, which reduces both swelling and the aching that comes with it. The fifth principle is starting gentle range of motion exercises within the first day or two. Simply sitting in a chair and gently bending and straightening your knee through the range that is comfortable, not forcing it, not bouncing, just slow and controlled movement keeps the joint from stiffening excessively while the injury is healing. Do this several times a day, 10 to 15 repetitions each time, and let the comfortable range be your guide. The sixth and most commonly skipped principle is getting a proper assessment within the first week. The initial management above settles the acute phase, but it does not tell you what is actually damaged, how significant it is, and what the right rehabilitation plan looks like. A physiotherapist can assess the ligaments and structures of the knee clinically, give you a realistic picture of what you are dealing with, and build a specific program that moves you through the recovery stages safely. The difference between a knee that recovers fully and one that becomes chronically troublesome often comes down to whether proper rehabilitation was started promptly. Do not wait months to seek a professional opinion. If you are still significantly swollen, cannot walk without a limp, or have had no improvement in pain and function after 2 weeks of correct management, that is a signal to get a formal assessment rather than continuing to wait. The goal of the first 72 hours is to manage the acute phase well, so you are positioned to begin proper rehabilitation as quickly as possible. The link in the description connects you with physiotherapy that can guide you through the full recovery from the initial assessment to returning to full activity